Today, our talk is on nutrition, and we partnered with Crystal Health. Dr. Kepha Nyanumba will be taking us through this talk. I think because of time, we can proceed, Kepha. The talk is recorded. We'll be sharing it with those who are participating and those who didn't have time to participate. You can pick it up, Kepha.
Thank you so much. My name is Nyanumba Kepha. I'm a consultant nutritionist. I work with the Crystal Consultants, and we offer a number of medical services, including nutrition, to various insurance companies. So today, I'm excited to talk about this interesting topic. And this topic is interesting because what we eat, before and during pregnancy assists in terms of enhancing the health status of our children. And this is during childhood as well as during adulthood. And that's why it's important for us to adopt a healthy lifestyle that comprises of a number of components. And some of these components include good nutrition. It actually includes stress management. As we're going to see, one of the reasons as why we get cravings is actually because of stress. I mean, stress actually provokes what you call the cravings. Now, our lifestyle comprises of rest as well, because sleeping is not a luxury, but a necessity. Now, good nutrition enhances maternal nutrition. It actually enhances maternal nutrition, and it also prevents pregnancy-related complications. Some of which are actually becoming very common nowadays, and we are talking of complications such as gestational diabetes. Of course, we're also talking of hypertensive disorders of pregnancy. And of course, for us to prevent these complications, what we need to do is to make sure that we observe good nutrition. Now, I know sometimes because of misconceptions, sometimes we are not able to make informed food choices, and because of that, there's usually increased risk of what we call micronutrient, deficiencies. And because of this, usually our body, sends us special signals that are supposed to alert us that we need to address our nutrition. And some of these, signals, of course, include food cravings, and we are going to see some of the food cravings that you should experience, that of course increase the risk of micronutrient deficiencies. But it's important for us to understand that for us to enhance maternal nutrition, we need to make sure that we first and foremost address some of the misconceptions that are actually common when we talk about nutrition and pregnancy. And some of these misconceptions include the fact that there are some of us who think that we can actually get all the nutrients from supplements, and therefore we can get all the nutrients from supplements without focusing on addressing our food choices, and that is actually a myth. So what we need to understand is the fact that supplements are supposed to assist us in terms of filling what you call the nutritional gaps. We know that during pregnancy, of course, there are certain supplements that are very, very important. I mean, supplements like folic acid and iron, as well as iodine, are actually very, very important. But of course, we should also make sure that we address our diet so that we can be able to get most of these nutrients from our foods. Now, the other common misconception that needs to be demystified is actually the notion that we need to eat for two. And this is actually a myth, because when you talk about our nutrition needs, especially during pregnancy, what you need to understand is the fact that there's usually increased need for energy and nutrients, of course, during pregnancy. But of course, during the first trimester, there's no need for the extra calories. But from the second and the third trimester, of course, usually there is a slight increase in terms of our calorie requirement, whereby during the second trimester, we need an addition of 340 kilocalories per day. And of course, during the third trimester, we need approximately around 450 kilocalories per day. Now, some of the dangers of eating for two include the fact that it actually tends to increase the risk of obesity, and that is why, as part of preparation for pregnancy, what we need to do is to make sure that our weight is actually within the recommended range. So weight management is actually very, very important. So always make sure that you know your BMI even before pregnancy. It's important for you to check your body fat as well, because that will assist you in terms of prevention of conditions such as high cholesterol levels. Or you also need to make sure that you understand your body water percentage, the muscle percentage. So you're supposed to do what you call the body composition analysis. And in case your BMI is above the recommended range, then of course it's always good for you to get guidance from a nutritionist. You need to get a meal plan that addresses your weight, so that come pregnancy, of course, the risk of getting some of the complications that we're going to talk about actually, will actually come down. So that is why it's very important, therefore, for us to begin when it comes to pregnancy by ensuring that we address some of these myths that might actually increase the risk of, excessive weight gain. Now, the other common myth is actually the notion that we are supposed to avoid seafoods because they are not safe. And this happens because of, issues to do with the mercury. But it's important for us to understand that not all seafoods actually contain mercury. We can actually go for options such as salmon and sardines, because we understand that seafoods are actually very important because they contain omega-3. Now, omega-3 plays a key role when it comes to brain development. It also assists in terms of reducing what you call inflammation. Now, unfortunately, most of the products we have in the market, especially processed foods, are actually known to contain a lot of omega-6 that increases the risk of inflammation. So it's very important, therefore, for us to make sure that we include, seafoods as part of our meals, so that we can be able to get omega-3. And that, of course, will assist our children not to get conditions like asthma, and conditions such as eczema. I know these are some of the skin conditions that are actually very common among children. So it's very important, therefore, for us to make sure that we address some of these misconceptions, because they're actually the same reasons as to why sometimes we expose ourselves to micronutrient deficiencies. And when that happens, of course, as I said, of course, our body sends us, signals that are supposed to alert us, because our body is always talking to us. Unfortunately, most people don't actually understand the body language. And that's one of the reasons as to why we end up lacking some of the important nutrients, that we need during pregnancy. Now, some of the ways, the body, talks to us is actually through what you call the cravings. And of course, when we get cravings, the body is trying to communicate something. Now, it's important for us to understand that cravings actually affect up to 50 to 90% of pregnant women. That is, worldwide. And before I talk about cravings, I want to differentiate, between the following three terms. And the first term is hunger. Number 2 is appetite. Number 3 is what you call the cravings. Now, hunger is actually the need for food. Our body sends us this signal when it senses that our energy levels have actually come down. And of course, once we get the signal, the next signal that we get is what you call appetite. Appetite is actually the desire for food. So remember, I said that hunger is the need for food. Appetite is actually the desire for food. But of course, craving is usually an intense desire for specific foods. It's actually an intense desire for specific foods. In most cases, craving is actually very common during pregnancy, because most women don't prepare for pregnancy. How do we prepare? For instance, what we need to do is to get a meal plan that is in fact 6 months before pregnancy, that is supposed to address our nutrition, requirements. So cravings are actually very, very common during pregnancy because of lack of preparation. And of course, when we get cravings, what we need to understand is the fact that this can happen because of increased nutrient needs during cravings during pregnancy. Sorry, for instance, during the second trimester, there is usually increased need for proteins, and therefore, when you start getting cravings for beef, it simply means that your body is actually trying to ensure that there's actually increased need for proteins. Now, sometimes we can also get cravings because of psychological factors. For instance, we know that stress actually provokes what we call the cravings. because there's usually increased need for energy and nutrients when we're actually stressed. And that is why it's very important for us to address stress. Now, there are many ways of addressing stress, but of course, the best thing we need to do is for us to make sure that we seek professional guidance, because by doing that, we'll be able to manage our cravings. Before I talk about hormonal changes, I've seen a number of people respond to stress by not eating anything, and such people are likely to get what we call the ulcers. Ulcers are becoming very common nowadays, and of course, when you get ulcers during pregnancy, what usually happens is you end up lacking a number of nutrients, and that, of course, might affect, your nutritional status, and of course, it will affect, the pregnancy outcome. Now, the other reason as why we usually get cravings is because of hormonal imbalance. And of course, when we talk about hormonal imbalance, it's important for us to understand that nutrition plays a key role when it comes to hormonal imbalance. And there's a number of adjustments that we are supposed to make for us to address some of these challenges. Now, we have different types of cravings. Now, we have craving for sugary foods, salty foods, fatty foods. Of course, some of us actually crave for non-food items. But for the ones who actually crave for sugary foods, the reason is because sometimes our body actually needs a quick source of energy. And then sometimes this happens because of skipping our meals. I've seen a number of people who actually skip their meals, and that actually tends to affect our blood sugar levels. And of course, this increases the risk of, cravings for sugary foods. And of course, the more you take the sugary foods, the higher the risk of getting some of the pregnancy complications like gestational diabetes that is likely to affect, our pregnancy, outcome. Now, some of the sugary foods most people crave for include, of course, the cakes that have a type of sugar we call, icing sugar. Now, some of us who might crave for soft drinks. In fact, soft drinks have the worst form of sugar. It's actually called high fructose corn syrup. It actually increases the risk of gestational diabetes during pregnancy. And of course, studies have shown that this actually would increase the risk of diabetes, type 2, that is after pregnancy. Next is salty foods, that is cravings for the salty foods. And when you start craving for salty foods, what your body is simply trying to do is actually trying to achieve sodium balance, meaning you might be suffering from what you call micronutrient deficiencies. And this is actually common during pregnancy because there's actually increased, blood volume. And some of us might actually end up getting cravings for salty foods, such as sausages. And in fact, we need to understand that one sausage can actually provide us with the amount of salt we need for 3 to 4 days. And sausage is actually a process, and that is why we need to make sure that we address some of these cravings, because processed foods actually affect us in a number of ways. Sometimes we see people who add excess salts to their food. That of course could also expose us to some pregnancy complications, especially preeclampsia, which is a form of high blood pressure that happens during pregnancy, and is usually accompanied by protein in the urine. So what we are saying is we need to make sure that we cut down, our sodium intake, so that we can be able to reduce the risk of some of these, complications. At times, you can actually crave for fatty foods, and when this happens, it simply means that the body is trying to force us to increase our intake of fats. But of course, we need to make sure that we address the source of the fats, because we have different types of fats. We have what we call the saturated fats and unsaturated fats. Now, what increases the risk of a number of disease conditions is what you call, the saturated fats. So what we need to do is we need to make sure that we focus on getting our fats from, the unsaturated sources, such as avocado, for example, that will assist us. Now, this of course plays a key role during pregnancy, because it actually supports, when it comes to brain function, among other functions. Now, what are some of the dangers of taking excess fatty foods, especially if we take a lot of deep-fried foods? That would actually increase the risk of obesity, and with that, of course, comes complication, a number of disease conditions, including high cholesterol levels. You might actually get gestational diabetes, etc. So that is why it's important for us to make sure that we address our food cravings, especially for fatty foods, salty foods, and sugary foods. But of course, some of us might also experience, cravings for non-food items. So whereby sometimes you go to the supermarkets and you find people purchasing, clay or stones, and that happens because of nutritional deficiencies. For instance, and these are the kind of people who are lacking iron. I mean, they have iron deficiency, or sometimes they're actually lacking zinc. And of course, I'm going to give you some of the food sources of iron. You can actually get zinc from, especially watermelon, from the seeds. So meaning when you're taking actually watermelon, remember not to get rid of the seeds because they are very important in terms of, they're actually very good sources of zinc. And the studies have shown that zinc plays a key role when it comes to coordination. Now, for us to be able to meet our nutrient demands, all we need to do is to observe good nutrition. And the term nutrition actually comes from the word nutrients. Now, anything without nutrients should not be classified as food. Unfortunately, you go to the supermarkets and you find people purchasing, products such as soft drinks. Sometimes we take biscuits that have what you call the empty calories. And these are the same calories that are usually converted into fat and stored around the abdomen. And that is why for women, for instance, we're supposed to measure that our waist circumference is actually between 60 to 80 centimeters. From 80 to 80 is overweight, above 80 is obese. And one of the simple ways you can actually use to maintain our waist circumference within the recommended range is actually by making sure that we cut down, our intake of processed foods. Now, for us to ensure that we are adopting a healthy diet, I want us to answer the following 3 questions the right way. Now, the first question is, what are we taking? That's a very important question. Number 2 is, how are we taking our foods? That, of course, touches on our food combination. Of course, next is when we are supposed to take our foods. Now, if I was to start by answering the first question, which is what are we taking? We are supposed to measure that we cut down foods that contain a lot of sugar. I've already talked about some of these foods. We also need to measure that we cut down our intake of foods that contain a lot of salt. And of course, we also need to measure that we cut down our intake of foods that contain a lot of saturated fats. Next is actually our food combination, which is very important because it actually enhances, appropriate food combination enhances nutrient absorption. And this is actually very important, especially during pregnancy. That is, it actually enhances, maternal nutrition. For instance, what we should recommend is when you're taking foods that are rich in terms of iron, then of course you need to make sure that you get a given source of vitamin C, because vitamin C plays a key role when it comes to iron absorption, especially from the plant sources. Animal sources are actually well absorbed. Animal sources of proteins of iron are actually well absorbed compared to the plant sources of iron, and that's why you need a given source of vitamin C. For instance, when you're taking spinach as part of your meals, then your choice of fruit is supposed to be a citrus fruit like an orange, because that plays a key role when it comes to enhancing iron absorption. The same case applies to other sources of iron, like when you're taking traditional vegetables. Of course, you need to get a given source of vitamin C to enhance iron absorption. And it's important for us to note that iron deficiency is one of the most common deficiencies in the world, affecting especially women and children. And one of the reasons to why this deficiency is common is because of our poor food combination. For example, I've seen people who cook very nice traditional vegetables, but they add cream to their vegetables, and without knowing, they actually interfere with iron absorption. And those are the kind of people, the kind of people who keep on taking, the iron supplements, and that happens because of poor food combination, because they don't understand that calcium binds iron. So what you're supposed to make sure that is, you're supposed to make sure that we don't combine foods that contain iron and calcium. We also need to understand that some nutrients, especially the fat soluble nutrients, need a given source of fat to assist in terms of absorption. For example, for the rich sources of vitamin A, including carrots, they need a given source of fat to assist in terms of the absorption of vitamin A. And the best example I can actually give you is avocado, for example. Avocado contains what you call the unsaturated fats. I've seen some of us take our carrots in form of carrot juice. I would not recommend that, especially during pregnancy, because it would actually increase the risk of gestational diabetes, because that increases what you call the glycemic index. So that is why we are supposed to measure that when you're using carrots, you need to measure that you use your carrots for cooking, because of course when you're using carrots for cooking, you're also using some cooking oils that of course enhances vitamin A absorption. There are many other food sources of vitamin A, including sweet potatoes. In fact, sweet potatoes are very good sources of vitamin A. They can be part of our breakfast, so that instead of taking a lot of wheat products that would increase the risk of excessive weight gain, we can actually introduce traditional foods such as the sweet potatoes, the arrowroots, etc. And of course, as we do that, let's also remember the aspect of appropriate food combination, so that we can enhance nutrient absorption. Now, sometimes we don't make the right food combinations, and because of that, we don't benefit in terms of the nutrients that we're supposed to get from our foods. For instance, I've seen people mixing, their fruits and yogurt, and that's what people call smoothies. And the question is, are they good for us? And the answer is no, because they actually increase the risk of digestive disorders. I mean, we are talking of conditions such as acidity, acid reflux, and these are conditions that also tend to be common during pregnancy. And the moment you start getting some of these conditions, it means that your digestion process is a bit compromised. So despite the fact that you're going to make informed food choices, because of poor nutrient absorption, you're likely to start getting cravings, etc. And that is going to affect you in terms of your pregnancy, outcome. The other combination that we need to begin about is actually taking more than one starch per sitting. I've seen people take, for instance, rice and chapati, some vegetables, rice, chapati, some vegetables, and a protein like beef. Of course, you really don't have to take more than 2 starches per sitting, because by doing that, you are simply increasing the risk of excessive weight gain. The same case happens when we take our protein. Sometimes you want to take chicken, you want to take, chicken, you want to take beef, etc. If you are doing that and you have conditions like acid reflux, of course, those conditions usually tend to be worse. And the moment you start getting the digestive disorders, of course, you're likely to start avoiding specific foods, and that is going to compromise your immune function. So it's very important, therefore, for us to measure that we address the aspect of food combination, because that is what will assist us in terms of getting most of the nutrients that we need during the different trimesters. For instance, during the first trimester, the number of nutrients that we need, and one of such nutrients is actually iron. We need to measure that we introduce food sources of iron as part of our diet, because iron actually supports the increasing blood volume during pregnancy. Some of the recommended food sources of iron include spinach, we have beetroots, we have beef, we have traditional vegetables. For some of us to take porridge, in fact, you can also get iron from brown porridge, provided you don't add milk to your porridge. I've seen people do that during weaning. Sometimes we add milk to the porridge when we're actually doing the weaning, which is something that we don't recommend, because that would still affect, iron absorption. And of course, we need to remember to get a given source of vitamin C, as I said, so that we can actually enhance, iron absorption. During the first trimester, again, we need other important nutrients like calcium. We know that calcium plays a key role when it comes to building the baby's bones and feet. It also supports the heart, muscles, and nerve development. And some of the food sources of calcium include dairy products such as milk. But of course, remember to get rid of the cream from your milk, especially if your weight is above the recommended range, or in case you have conditions such as high cholesterol levels. You can also get, calcium from yogurt. In fact, for some of us who might be having conditions like lactose intolerance, yogurt could be a good option, because it's actually easy in terms of digestion. Now, I actually write articles to various newspapers, and there's one of the articles that I've actually written about lactose intolerance. Maybe once the article is actually published, I can also share it, because lactose intolerance is also becoming very common nowadays, and that's one of the reasons as to why women tend to avoid dairy products, especially during pregnancy, and this, of course, could affect our pregnancy outcomes. We can also get calcium from seafood such as sardines. You can also get calcium from nuts. You know that we have different nuts, the walnuts, the cashew nuts, the peanuts, etc. Of course, you can also get calcium from seeds, including the chia seeds, the flax seeds, the pumpkin seeds, etc. We cannot talk about calcium without talking about vitamin D. Now, vitamin D is a free nutrient that we're supposed to get from the sun. All we need is just time for us to go outside to the sun, because the sun is actually the best source of vitamin D. It's actually known to support calcium absorption. Meaning, if you have vitamin D deficiency and you're increasing your food sources of calcium, then of course, because of poor calcium absorption, you're likely to get many other disease conditions, and that is why you really need to measure that you get vitamin D from the sun. It also plays a key role when it comes to our bone density, of course, and of course, it plays a key role when it comes to our immune function. So when you want, of course, when you want to address our immunity, it's very important for us to make sure that we consider doing what you call the vitamin D test. Now, apart from the sunlight, you can also get vitamin D from eggs, seafoods, etc. Now, the best way to take your eggs is actually by ensuring that you take boiled eggs instead of fried eggs. We know that fried eggs tend to have a lot of calories because of the use of cooking oils. Now, 1 gram of cooking oils contains around 9 calories, and that, of course, would increase the risk of excessive, weight gain. That is for some of us who are trying to manage our weight. So we actually prefer that you take, the boiled eggs. That can be a good source of proteins, especially during breakfast. We know that proteins are very important as part of our breakfast because they take a longer time in terms of the digestion, so that maybe around 10 or 11, you really don't have to go for some of the deep fried foods such as mandazis, etc., because I know that's what usually happens, especially in the offices. We also need nutrients such as iodine. Now, fortunately, we'll be able to get iodine from our table salt because it's actually fortified with the iodine. And iodine is one of the key nutrients that plays a key role when it comes to our metabolism rate, which is the rate at which our body actually functions. Now, we know that when our metabolism slows down, the rate of weight gain usually increases. We can try to control our food portions. We can try to increase exercise, but of course, our efforts might not get to the top of the mountain. And that happens because of the slow metabolism rate. Now, as part of the body composition analysis, we usually check your metabolic age, which is a measure of how your body is functioning compared to your actual age. If your metabolic age is above your actual age, it simply means that your metabolism rate is a bit slow. And we have special meal plans that can assist you in terms of jump-starting your metabolism rate. So we can actually get iodine from iodized salt. You can also get it from dairy and, of course, seafoods. Now, iodine plays a key role when it comes to brain and thyroid development. Now, we also need other nutrients like vitamin B6. And vitamin B6, according to studies, actually supports, brain development, just like iodine. It also assists in terms of addressing nausea. We know that nausea is usually very common during pregnancy. And this is one of the reasons as why we end up avoiding, specific foods. And that's why we need to introduce, food sources of vitamin B6 as part of our diet. Examples include, poultry, like chicken, for example, is actually a very good source of vitamin B6. But of course, remember to get rid of the skin because the skin will actually increase the risk of high cholesterol levels. You can also get vitamin B6 from potatoes, from the bananas, etc. Now, during the second trimester, the focus is on rapid fetal growth and skeletal, development. And there are some nutrients that are very important. And the examples include, for example, we have what you call the protein. In fact, the need for protein per day is supposed to be approximately 71 grams per day. And that is why for some of us with conditions such as digestive disorders, or sometimes we have allergies, and these conditions actually force us to avoid, proteins. This would actually affect our pregnancy outcome. And that is why it's very important for you to seek professional guidance. You need to come for a meal plan so that you can be able to address some of those allergies, so that you can be able to, take all the proteins. In fact, we have different types of proteins. We have what you call the animal proteins, including chicken, seafoods, beef, etc. You also have what you call the plant proteins, including the legumes like, yellow beans, or the red beans, the lentils, the green grams, etc. Now, for some of us with conditions like acid reflux or acidity, I know sometimes we avoid legumes and we end up taking a lot of animal proteins. By doing that, of course, the risk of high cholesterol levels increases, and that, of course, would also interfere with our pH. So it's very important, therefore, for us to make sure that we interchange our proteins, and by doing that, of course, we'll also make sure that we are addressing our nutrition status during pregnancy. So these are some of the sources of proteins. Examples include poultry, the lean meat, seafoods, eggs, dairy products, legumes, nuts, and seeds. Now, nuts and seeds can be very good sources of our snacks. So sometimes in between our meals, we might feel like taking something, so we can always make use of nuts. For instance, you can also, take dairy products like yogurt, etc. Now, we also need calcium, of course, which is also very important during the first trimester. And apart from calcium, we also need nutrients such as omega-3 fatty acids. And that I said actually plays a key role when it comes to brain development. These acids are also known to prevent, the risk of conditions such as asthma and food allergies, as well as eczema, that is in infants. Now, this happens because, as I said, omega-3 fatty acids are actually known to reduce inflammation. Now, there's a test that assists us in terms of understanding your levels of inflammation, like ESR, that stands for erythrocyte sedimentation rate. Or there's another test that you usually call, CRP, a C-reactive protein. So in case you suspect that you have high levels of inflammation, you can always request for some of these tests so that you can be able to understand the root cause. Now, some of the food sources of omega-3 include, the seafoods that I talked about, the salmon, the sardines. You can also get omega-3 from cod liver oil, seeds such as chia seeds, the pumpkin seeds, flax seeds, etc. Now, apart from omega-3, you also need other nutrients such as magnesium, that is actually known to play a key role when it comes to muscle function, and of course, it also prevents what you call the cramps, especially the legs. And some of the food sources of magnesium include the whole grains, of course, the seeds and the nuts, etc. Now, during the third trimester, some of the important nutrients we need include vitamin C. That is among the other nutrients. And of course, we know that vitamin C actually supports immune function. It also enhances iron absorption, as I said. And it's also one of the nutrients that actually serves as an antioxidant. Now, antioxidants are compounds that assist in terms of fighting what you call the free radicals. Sometimes when we are stressed, or sometimes during the digestion process, our body produces what you call the free radicals. And we need antioxidants to be able to get rid of the free radicals because they're known to, suppress our immune function. Free radicals are also known to quicken our aging process. So it's very important, therefore, for us to make sure that we increase food sources of vitamin C so that the body can be able to fight, or to get rid of the free radicals. So some of these food sources include, we have the oranges, the mangoes, the guavas, the lemons, etc. Now, in case you have acidity or the acid reflux, as I said, of course, you can always assist you to address those conditions so that you can be able to benefit from some of these, foods. You also need other nutrients like choline, a very important nutrient that supports brain development. It also supports what you call the neurotube, prevention of the neurotube defects. And some of the food sources of this nutrient include the lean meats, the legumes, the eggs. Now, when you talk about beef, what you're supposed to make sure is that you're supposed to take what you call the lean meat, like steak, because we don't recommend red meat. It actually increases the risk of high cholesterol levels. So when you're going to purchase your beef, make sure that you go for steak. Of course, you also need legumes. Examples of legumes include what I already talked about: the green grams, the chias. The green grams. The lentils, the yellow beans, pigeon peas, etc. And those are some of the important sources of choline, a very key nutrient when it comes to prevention of the neurotube defects. Of course, you also need other nutrients like iron. I've already talked about iron. Apart from iron, of course, we also need to make sure that we are keen in terms of our fiber intake. It's actually very important because during pregnancy, some of the challenges we experience, of course, include constipation. And this happens because of the fact that sometimes our digestion process is usually a bit compromised. And one of the simple ways we can actually address it is by ensuring that we address our fiber intake, meaning we need to increase the foods that are rich in terms of fiber content. Examples include the whole grains, the fruits. Of course, we know that not all fruits have the same amount of fiber. For example, you cannot compare an orange to an apple. Or maybe oranges tend to contain more fiber compared to apples. The same case happens to the ripe bananas. Still, oranges still remain to be good sources of fiber. You can also get fiber from vegetables, especially the green leafy vegetables, including, the traditional vegetables, depending on where we actually come from. You can also get fiber from legumes, the lentils, the beans that I talked about, nuts, etc. Now, I cannot talk about fiber without talking about your fluid intake. But before I talk about that, it's important for us to also understand that we need some healthy fats, especially during the third trimester. And this actually plays a key role in terms of assisting, or supporting the development of the baby's brain as well as the nervous system. Now, some of the sources of unsaturated fats that actually the good fats include, the avocados, meaning sometimes instead of using bread spreadings like margarine on your bread, why can't you use avocado? Can actually serve as a good source of bread spreading. You can also get healthy fats from the nuts that I talked about, the seeds. And for some of us who use olive oil, is actually good because it's actually classified as one of the unsaturated fats. And as I said, of course, this plays a key role when it comes to, especially the supporting, the nervous system. Now, as I said, we cannot talk about increasing our fiber intake, which plays a key role in terms of prevention of constipation, without talking about hydration. Because if you're going to increase your fiber without addressing hydration, then of course you would actually increase the risk of constipation instead of preventing constipation. Now, when we talk about hydration, usually during pregnancy, there is actually a need for us to increase our water intake. In fact, on a daily basis, we need approximately 3 liters of water per day. We know that the average for some of us is actually 1.5 to 2 liters. That is before pregnancy. But of course, during pregnancy, usually there's increased need for water, and we're going to see some of the functions of water. Now, part of this water is supposed to come from some of the foods that we eat, but most of the water is supposed to come from by actually drinking the pure water. But you can also get water from soups. You can get water from fruit juice or the juices, of which during pregnancy, of course, we try to encourage us to make sure that we cut down our intake of juices, because juices tend to have what you call a high glycemic index. That is in case you are diagnosed with a condition like gestational diabetes, then of course you might be forced to ensure that you actually eat your fruits instead of drinking your fruits, because by doing that, of course, your blood sugar levels might not be well controlled. Now, some of the food sources of fluids, of course, include fruits such as watermelon. It's actually very good in terms of water content. The purpose, etc. But of course, let's make sure that most of the water actually, most of our fluid intake actually comes from water. I know some of the reasons as to why most of us might not take water include the fact that at times we don't like the taste of water. That is why we have flavored water in the supermarket. And the question is it the same as pure water? And the answer is no, because flavored water tends to contain some calories. So for some of us who are trying to manage weight, of course, we need to make sure that we don't go for the flavored water. In case you don't like the taste of water, you need to understand that you might be having issues to do with the electrolyte balance, and that can be addressed. And sometimes we don't take water because we don't remember to take water. But our body is supposed to remind us to take water. If that is not happening, then it means that the body has started to malfunction. Because at times we don't take water because we don't know why we need to take water. And of course, you're going to see some of the reasons as why we need to increase our water intake, especially during pregnancy. Now, there are special considerations that we need to make, especially when it comes to our water intake, especially during pregnancy. Now, during the hot climates, of course, we need to increase our water intake. The same case should also apply on the days when we exercise. Sometimes when we experience vomiting, of course, we also need to understand that we also lose fluids. Number 2, we also lose what you call the electrolytes, and that is why it's very important for us to address that. Now, some of the reasons why we need to increase our water intake during pregnancy include the fact that water supports the increased blood volume. It actually maintains the amniotic fluid levels. It plays a key role when it comes to the digestion process as well as nutrient absorption. Of course, it also plays a key role when it comes to constipation and, of course, prevention of what you call the UTIs, the urinary tract infections. So some of the signs that can assist us to know when we are dehydrated include, the dry mouth. So the moment you start experiencing dry mouth, of course, you need to understand that your body is simply sending you an important signal that you need to increase your fluid intake. The color of our urine can also assist us. That is, if you get, let's say, dark colored urine, then of course you need to understand that your water intake needs to increase. And of course, sometimes our frequency of urination can naturally come down. That would be a signal that you need to increase our water intake, but that also depends on the time. If, of course, the frequency of urination increases at night, which is not the right time when we're supposed to rest, then that will be a sign of, gestational diabetes. And that is why we need to understand that at night, we are not supposed to wake up, 3-4 times to take water. And of course, for frequent urination, it will be a sign of some of the complications like gestational diabetes. Sometimes you might actually experience lightheadedness or dizziness, and that will be a sign of dehydration. If at all, your iron levels are actually within the recommended range, etc. Now, as we address, our water intake, the other thing we also need to understand is sometimes, as I said, during pregnancy, you might actually experience some complications, and nutrition plays a key role when it comes to the prevention and effective management of these complications. We are talking of some of the common complications like, gestational diabetes, high blood pressure, including preeclampsia and eclampsia as well, neural tube defects, sometimes low birth weight, etc. So I'm going to talk about just a few of them so that I can be able to give you time for questions. I know we have like 3 minutes, but we might actually extend a bit if we are actually allowed to do that, so that we can be able to answer all your questions. So let me talk about gestational diabetes, which is actually common during pregnancy. Now, it's important for us to make sure that we monitor our blood sugar during pregnancy. You can actually do a test we call fasting blood sugar. If your fasting blood sugar is above 6, then of course you need to make sure that you do another test that is known as HbA1c. That actually gives us, your average of blood sugar for the last 3 months. Now, if your HbA1c, also known as glycosylated hemoglobin, is actually above the recommended range, it's actually supposed to be 4 to 6. And of course, it means that your blood sugar is actually getting elevated, and you need to make adjustments in terms of your lifestyle. Sometimes during pregnancy, a doctor, the gynecologist might actually recommend tests such as a glucose tolerance test. And all those tests are actually meant to assist us understand if your sugar is actually within the recommended range. But in case the sugar is above the recommended range, then of course you don't have an option but to make adjustments in terms of your lifestyle. And some of the adjustments you need to make include, making sure that you avoid refined starches. Refined starches could mean, instead of taking, white bread in the morning, you'll be forced to take, a brown bread or the wholemeal bread. Instead of taking, the mandazis, the cakes, you'll be forced to, embrace traditional foods such as the sweet potatoes, the cassavas, the arrowroots, etc. You also need to make sure that you increase the food sources of fiber. In fact, fiber is very important when it comes to blood sugar management, meaning you need to increase your intake of vegetables, especially the green leafy vegetables. You also need to make sure that you introduce healthy fats as part of your diet. Examples include what I've already told you, like the avocados, that will actually assist you in terms of blood sugar management. In case your BMI is above the recommended range, of course, during pregnancy, we don't recommend, weight loss. But of course, we can always give you a meal plan that ensures that you are getting all the nutrients that you need. But at the same time, the rate of weight gain is a bit controlled, because we've also seen pregnant women who actually gain a lot of weight during pregnancy. That, of course, increases the risk of pregnancy-related, complications. Now, we also have other conditions, such as hypertensive disorders of pregnancy. Remember, I talked about of a condition like preeclampsia, whereby there's usually elevated blood pressure, and of course, this is usually accompanied by by protein in the urine. And that is why we need to make sure that we are keen in terms of our lifestyle, so that we can be able to prevent some of these conditions. Now, some of the adjustments we need to make include, of course, addressing our intake of calcium, meaning we need to ensure that our calcium intake is actually adequate. We also need to make sure that we increase, our intake of food sources of potassium. Now, potassium actually is one of the nutrients that assist in terms of bringing down blood pressure. It's actually the opposite of sodium. So meaning we also need to make sure that we cut down our intake of foods that are rich in terms of sodium. The examples I gave you include, the processed foods, because manufacturers use sodium as one of the preservatives. And therefore, at the moment you discover that your blood pressure is not well controlled, then you don't have an option but to ensure that you actually cut down your intake of processed foods because of the sodium content. You also need to make sure that you increase your magnesium intake. And of course, the same case needs to happen to the antioxidants. Remember, we say some of the food sources of antioxidants, of course, include the fruits, some of the vegetables, especially the green leafy vegetables, and of course some whole foods. Now, apart from this, when it comes to blood pressure management, again, we need to make sure that we actually keen in terms of stress management. Remember, I said that stress increases your nutrient and energy demands, and therefore, for you to be able to manage, high blood pressure, you need to make sure that you manage actually stress. You also need to make sure that you increase your water intake. Now, water controls your blood volume, and that is why it's important for us to increase water, because it actually plays a key role when it comes to blood pressure management. As a summary, so that I can be able to give you time for question, let me say that what a mother eats actually during pregnancy does not just feed her baby, but it actually programs, their future. What a mother eats during pregnancy does not just feed her baby, but it programs their future. So thank you so much. Once again, my name is Nyanumba Kepha, consultant nutritionist. I'm actually based at Apail, KMS Center, 3rd floor, 310. In case you need assistance, these are the contacts as we prepare for the questions. These are the contacts. The phone number is there. The email is actually, the email address is there. I post a lot of information online. The articles I share with the various newspapers and the magazines, you can actually get part of this information by checking my blogspot, which is kefanyanumba.blogspot.com. Thank you so much. I want us to take this time for questions. Moses?
Thank you, Kepha. We'll open for questions. I think you can raise your hand or just go ahead and ask questions if you have any questions. But thank you for very insightful talk, and I think it has been beneficial. So we'll be taking questions, and Kepha is here to respond to any questions that you may have. All right, since there's no question, then we've recorded the talk. We'll be sharing it to those who attended and those who signed in for the talk and were not able to join. So at this point, I just want to thank you, Kepha, and thank those who have had time to join. We are doing this series of talks. If you go to our social media handles, that's the Calgary Health. We've done, this is the 4th talk, so we are doing a series of talks, health talks, focusing on majorly women, and because these are predominantly the patients we see. And I think it will be open up for other discussion depending on the needs for the audience. But thank you all for joining. I'd want to close this talk and wish you a good evening. Thank you, Kepha.
Thank you, Moses.
All right.